Now, I sat down this week with the Secretary of Health and Human Services, Alex Azar, to discuss Medicare, the opioid crisis, and more. Take a look. Secretary Azar, thanks so much for being with us tonight. I appreciate it. This is your first trip on Justice. I want to talk to you about health care. You know, it's not something we cover a lot on Justice, but, you know, during the midterms, there was a lot of talk about health care, and that all of a sudden popped up. And now there's a lot of talk about Medicare for all. What does that mean?
Yeah, well, first, Judge Jeanine, great to be on your show.
Thank you.
Glad you're talking health care. It's very important. So Medicare for all would be basically taking everybody else in the country and putting them into the Medicare program. Now, the Medicare program is a great program for our senior citizens. It's a promise we've made to our seniors.
Right.
But you start expanding that out to everybody else, what's going to happen is you're going to undermine the employer insurance market. 140 million Americans get their insurance from their employers. Well, you get Medicare competing there as an option, paying Medicare rates, which are much lower to hospitals and doctors than what private insurance pays. They won't be able to compete. It'll run them out of the marketplace. It'll be a single-payer system, one size fits all for every American, and it'll undermine seniors' access to health care.
And it would undermine them in what way?
Well, what'll happen is doctors and hospitals are going to leave the program because they'll say, I can't make a living
on this.
I'm willing to take less money for Medicare reimbursement because I'm taking care of seniors, but I have all these regular private sector patients that I can make money on.
Right.
You give those Medicare lower rates to everybody else, they're going to say, I can't make money. I'm going to pull out of the system. And the better doctors, just like you see in Europe, the better doctors and hospitals will pull out of the system. Seniors' access to care will be hurt. And bottom line, our system is already going to go bankrupt. We need solutions for fixing Medicare solvency over the long run. And they want to add $32 trillion of expense.
Let me ask you this while we're on the issue of seniors. You know, my mom is a senior, and like many of her generation, I mean, they've gone through depressions, and they're on fixed incomes. I mean, they're not working. My mom is 89. You know, she'll go to a pharmacy and she'll call me up and she'll say, you know, Jeanine, I got a prescription for $500. You know, what is Donald Trump, what is the president, what is the administration doing about seniors who, because of the way they are, they start making choices. They prioritize. Oh, I have to get my medicine this week. I have to be careful about everything else.
So, as you know, the president cares deeply about the struggles that seniors are having in terms of access to their drugs. That's why he has made reducing drug costs so central to everything he's doing in health care. So what has he done? He's approved more generic drugs during his term than ever in history. That brought $26 billion of savings from that competition of low-cost generics. He passed the gag clause provisions that say that pharmacists can no longer be gagged from telling seniors that they can buy their drugs cheaper if they just paid out of pocket than using their insurance. He's changed how we reimburse drugs.
That's very interesting, because my mother has mentioned that too. Yeah. She's mentioned that her pharmacy has said, you know, if you pay cash and not submit it. Isn't that amazing?
Now you have a right to ask your pharmacist, thanks to Donald Trump.
Okay. All right. And let's talk about the fact that Europeans are getting the same medicine at a different lower price?
Yes, at lower prices. So we did a study, and we found that Europeans, Japan, and Canada are paying much less than we are for drugs. We're paying 1.8 times what they are for certain drugs in our Medicare program.
Wow.
So President Trump said, America first, no more. What we're going to do is require that if the drug companies voluntarily give these deals to other big, powerful economic countries, they have to give us a cut of that same bargain in our program and give us a 30% discount that gets down to the rates they would. So it puts Americans first, stops foreign free riding on American investment in R&D, but it preserves seniors' access to the same medicines.
Okay, let's talk about the opioid crisis. The opioid crisis involves people who go to their doctors, get medication, and then become addicted to it. How is the president going to, and you through your agency?
So the president has really led a historic effort to tackle this devastating drug addiction crisis. And the key thing is the majority of people who get addicted to opioids start, as you said, with a legal opioid prescription. They get the wisdom teeth taken out, they have surgery, and they get pain medicine, and they become addicted. So what he said is, we're going to cut legal opioid prescriptions by 33% during my term. Guess what? Already he's cut it by 28%.
Fantastic.
Well on track. And as a result, we're seeing deaths from opioid overdose plateauing. We're seeing utilization of opioids reducing. We're seeing first-time use of heroin coming down. So all the trends are in the right direction. Long way to go, but everything's going in the right direction.
Well, we appreciate your being with us, Secretary, and we appreciate the work you're doing for all Americans. Thanks for being with us.
Thank you, Judge Jeanine.